Fellow Rotarians and guests, I'd like to introduce to you our speaker for the day, Hayley Jack. She is an experienced manager in the non-for-profit sector with a healthcare background. She started her new role as the executive director with the United Way of Leeds and Grenville this past November. Prior to this, Hayley was the office manager of a local medical center. She has extensive experience in healthcare as a registered practical nurse, and we also know her as the past executive director of the Brockville and Area Food Bank. Rotarians will present to you, Hayley Jack.
And I pass Rotarians.
Good morning. I'm glad to be back at Rotary. I have missed it. I've been telling Doreen it's hard working for 3 doctors. They keep you pretty occupied, so being back in the community is something I have longed for, and so I'm so glad to have this opportunity with the United Way, and excited to be here today. So, pretty short presentation today, but it's going to cover a lot of stuff. So, as you know, you've supported our Urgent Needs Fund, so I wanted to give you a little update on how that is going, and then discuss some of our plans for 2024, some of our direction we're going in.
Use the arrows to the right. Arrows to the right.
So our Urgent Need Fund, so who gets this fund? They have to live in Ontario, have a Canadian bank account, be 18 years or older, and if you're in receipt of Ontario Works or ODSP, we do ask that they have already asked the counties for help, because a lot of our work is very similar to what the counties can do for people in receipt of those funds. If they're denied by the counties, we will certainly help them. When can they get these funds? So it's unexpected urgent household repairs and expenses, social integration to maintain employment, special diet requirements not in receipt of Ontario Works or ODSP, as they have a special diet allowance already available, and unexpected expenses to maintain employment. So you can see it's kind of a big umbrella, and we have focused it around employment. So we really want to stop somebody from not being able to pay their mortgage or be able to pay their rent. So if their furnace went and they couldn't afford to pay for that, then we would step in and help pay that bill. We are paying vendors directly, and it is up to $500 right now for the grant. So if somebody's expense is only $200, we will cover the full $200. If it's above $500, we'll cover $500, but we are open to going above that, as this is a brand new program, but we have capped it at $500 just to give ourselves some guidance. A recent CTV News report said that 52% of Canadians are $200 away from not being able to pay their bills. So I think our program is really relevant to hopefully impact a big group of people. And how? So we have partnered with the Volunteer Center. They are being our administrator for this program. They already do LEAP funding, which is electricity support. So they're very used to talking to people about their incomes and different supports in the area and passing referrals on. So they have a lot of skills that maybe we wouldn't be able to offer people calling in. So they're a great partner for this. And they can receive funding at this time once a year per household, and not within 6 months of the last application. So trying to avoid people applying in December and then reapplying in January. So spreading it out so everybody can access it. And it is it's brand new. So I don't know where this is going to be in a year, if our grant will increase or the times will increase. But right now, just starting off slow. So again, the qualifying finances. So this is just a guide for us. We are open to, looking outside of the boundaries to be able to help people, but we wanted to make sure that the minimum amount that the maximum amount that we would support is over the traditional low-income support. So it is up to $55,438 of annual income. We will still be able to help that household. So the next piece I wanted to touch on was our community impact. So last year, Jane Hess, the last 2 years, was very entrenched in our community, asking our community what they think the United Way is, where they think we should go, what we should focus on. Kind of the community impact goal that we've come out of it with is what can make long-lasting change that lives on in our community after the program ends. And the areas of interest that our community identified, so this was not our group, this was Leeds and Grenville. They want the United Way to focus on homelessness, housing, children and youth, and food security. So in response to this, we started the Urgent Needs Fund to help with the homelessness and housing, to try and keep people housed right now. So how has it changed our work otherwise? So applications to our fund, our allocation dollars have been submitted still under Poverty to Possibility, Strong Communities, and Healthy Children. And we're looking closely at the programming and its potential for long-term lasting change in our community. So again, tying that back into our community impact study, is it creating change in those categories our community asked? And we are exploring the difference between proactive and reactive programs. I will go through that next. And we're focusing more on the program we fund versus the organization. So we really want to see what the program is doing that we're putting our dollars, or the community's dollars, into. So reactive programs versus proactive programs. So I'm using Urgent Needs here as an example because it is a good reflection on the difference. So these programs are stepping in to help after the big issue has already happened. So for example, they have already experienced homelessness. And proactive programs are programs that are created to prevent issues in people's lives. For example, Urgent Need Fund is available to prevent homelessness. One question that we've kind of all put on our desk is long-term lasting change is our goal. And the question is, will the impact continue for people if the program disappears? Will there be something that these individuals are able to take from it and use in their lives? So this is the other half of our year, so we're just focusing on networking and building relationships. I'm brand new to the position, so I have a lot to do. 1957 is when it was started. There's so much history. So just focusing on fostering collective action and community impact through networking and building relationships. So we want to build relationships with all individuals, corporations, business, nonprofits, local leaders, political leaders, and more. Developing new and fostering existing workplace campaigns. There are a few new factories in our area, so can we get in and do some new workplace campaigns? Building knowledge on 211 service in our area. So we currently have a co-op student who is just dedicated to working on 211. That's new for us. She's getting some training for 211 on how to be a trainer for our local organizations, how to make that space more useful in our community. It is completely dedicated to resources, and 211 service provider that we work with is actually starting now referring people. So if someone calls in for their senior parent needing transportation and identify maybe they're having a hard time making meals, they'll make the referral to the organization that could make them meals. So it's a really great resource that we want to put our work into. As you know, we have our Gord Brown Memorial Golf Tournament, which is coming up, and our 3M Harvest Lunch will happen this year. And then building relationships with our funding partners. So we are bringing back Day of Caring. Day of Caring is a really great initiative that hasn't happened in a few years, but it is a United Way Canada initiative that happens where organizations such as Rotary or local factories, businesses, dedicate employees on June 7th is this year, and they go into our funded partner organizations to provide volunteer hours. So whether they're painting, cleaning up sidewalks, anything, so we're starting to organize that. We're going to host a networking session for our funded partners, really trying to bring them all together. I mean, the one thing that they have in common is the clients that they're working with, and they're quite a wraparound service, so we're hoping to bring them all together this year. Board of director visits, so I've asked my board of directors if they'd be okay to go to each organization, so we're gonna hit up each funded partner, not the whole board of directors at once, one at a time, and advocacy for our funded partners. So we've already started that a little bit. Each week I'm on Bruce Wiley for the United Way, and instead of talking about us for the next little bit, we're highlighting the work being done by our funded partners. Last week I talked about the Volunteer Center income tax program, and this week, I'm just getting over a cold. This week is, R&J Youth has an event this weekend, so we'll be highlighting that. That's it. Any questions? Yes, Dave?
Yeah, you mentioned to me last week when we met, in reference to a sponsor that's gonna be matching some of your funding, giving. Maybe that might be a catalyst or some leverage for others to get involved to bump that number up. You want to speak to that?
Yeah, so we have an anonymous donor who is, thank you Dave for bringing that up, who is matching 3 sectors. So we have multiple sectors that we fundraise in. Once P&G left, donations from them are gone, unfortunately. So really trying to think outside the box how we can raise it in other sectors. So this anonymous donor is challenging us, giving us monies. So whatever we raise in education, healthcare, and municipality will be doubled this year. So every donation coming in from those will be doubled. Up to a certain amount, but the amount's amazing. So really trying to work on those 3 sectors. If anybody has any contacts, let me know. Yeah.
What's a 211 service?
So 211 is a phone number. It's you just dial 211 on an Ontario line, or it's actually national, so across Canada. And you can be connected with a local service provider that will point you in the direction of a resource. So if I was to go to Ottawa and I didn't know where town hall was, or if I was living in Ottawa and I needed food support, I could call 211 and they could say, here's where you go, here's the addresses, here's how you get there, here are some transportation to take you to and from. So it's a resource that is supported by the United Way. It was actually started by the United Way years ago, and now 211 has started its own nonprofit we work very closely with. It was heavily used over COVID, and it's bigger in the larger the larger cities, of course. Not so much in our rural living, but as you can imagine, I mean, we can all think about a time we might use 211. So we really feel positive that the only good can come from selling it. There is also a website, so you can go onto 211 website and you can say where you live and you can put in, senior support, and we'll list all the supports available. So instead of having to search the web yourself, they're doing the work for you. Mm-hmm.
More questions, Don?
Hi, Haley. I'm just remembering some conversations we've had with Trish in previous times, and some of the emphasis there was on networking with the other 50 organizations in the community or agencies that tend to deliver different services to various people. I'm just wondering, I know you got up on your screen, you had networking and community organizations, so just wondering if you can speak to that a little bit more, if there's, how you tend to address that, I guess.
I think when Trish and Jane were here, they were networking with a large group of people through community impact. So I wonder if that's what she was speaking to. I mean, I'm part of a few roundtables, and I'm able to go out and talk with the community. As for our networking this year that we want to host, it's going to be for our funded partners to come together. So the organizations that we fund. We would love to do a bigger networking session to kind of teach about community impact a little bit more. I mean, we have 2 years in it. We are seeing, how if we all shift our focus into long-term lasting change in our programming, a few additions might make the difference between just being a program versus doing long-term lasting change. But as of right now, it's just going to be networking with our funded partners, and then I am at roundtables. But when Jane and Trish were doing the actual study, they were conducting many conversations with organizations and people in Leeds and Grenville. I hope that helps.
Renee?
As a former P&G'er, one of the fondest memories I have were the Day of Carings. They were great. And we'd be able to shut down the entire plant.
Yeah.
We would shut it down for 4 days so people could come off shift so that they could participate. How are you reaching out to plants like Leclerc and others? Is that part of the, even Rotary committees, groups? It seems like there's a lot of potential, and honestly, the impact we'd make 600 people heading out into the community to do community type work had a huge impact. So it's really good, one, comment to see that Day of Caring is coming back. But I know it takes a lot of coordination. There must be a lot of behind the scenes work going on.
Yeah, it is a lot of behind the scenes, and it's so Wendy is our admin, and myself, it's our first year that we're going to be doing it.
Okay.
Seems straightforward, connecting people with people, but yeah, it is a lot behind the scenes. We are definitely going to be working with our funded partners to make sure they get help, and then we were thinking about one organization that's in every area, and of course you know my background is food banking. There is a food bank in almost every community. So if we could put if we have a lot of volunteers that want to help, we could put our reach a bit further and then touch each community in Leeds and Grenville by sending volunteers to their food bank if they need help. And then, of course, if there's other organizations that want to be involved that aren't necessarily our funded partner, nonprofits, and we have extra volunteers, we'll reach out too. But starting with our funded partners, and as for Leclerc, Leclerc and I actually spoke with an employee there, and they're lovely, but they're certainly not P&G, and you know, they're a family. Even though they're very large, they're still very much a family business. And I think we'll build a relationship with them. It'll be a slow build.
Yep.
They're absolutely lovely. I think Dave Caring would be a great way to start working with them. So we're gonna reach out to them about that, and then reach out to the other, I mean, we have quite a few places that do workplace campaigns for us, so those ones that are already involved. But for the new ones, it would be a nice way for us to connect and them to see like how fun it can be. I mean, I've just heard stories.
Oh, amazing.
But volunteering is so good for the soul, so I think hopefully we'll build a few new relationships.
Best of luck with it. Thank you.
Excuse me, how many requests have you had for the urgent funding yet?
So Volunteer Center is we've had quite a few. I have heard of one story. So it was she had immigrated to the country and the husband passed away. No inheritance but a house. Couldn't afford the house. Trying to sell it. So she couldn't pay her bills, paying her mortgage. So we were able to help with some of the bills in the meantime while she sells it. That's one of the success stories I've heard, but it is quite an outreach. We've also had people calling into our office. It's a great time of year to start it because they're doing their income tax program. So their income tax program gets money into people's pockets also. So through that, and they are tasked with, is there other supports, existing supports out there already that they can connect them with? So I know there's a lot more happening behind the scenes than the stories that are actually getting to us of people who truly have nowhere else to turn.
You might want to connect with some of the churches in the area because a number of them have funds available for benefacting things like this as well. So maybe
For the urgent needs.
Yeah.
That's a great idea, and actually we're going to apply for a grant through the provincial government, the seniors grant, and then we can reserve just for our senior population. I was talking with Keys Job Center in Gananoque presenting on urgent needs, and they said they've had an uptake in seniors trying to get back in the workforce because they can't afford to live on their pensions. So really trying to look into the seniors also, and yes, I'll reach out to the churches. That's amazing.
Good stuff.
Any other questions?
Thank you, everybody.
Thank you.
Well, thank you very much.
Run away.
Yeah, don't run away yet. Well, I guess on behalf of everyone in the club, I want to thank you very much for taking your time to come and make a presentation to us. I know that there's quite an I'll call it cross-pollination graph between Rotary and United Way. We have, I know a couple of our members are involved with United Way. Ian McFall, I think, is he still a chair? And Chris Dang is on your board, I know. And we appreciate that sometimes from your organization, people come to our meeting, and I think most people know that United Way is a corporate member of our club here, which is great. So, your organization sets a great example for Rotary, actually. I mean, I think everybody, you mentioned volunteering. I think everybody in here has sort of similar objectives to what United Way does, and we can learn a lot from you about how you do it. And the Urgent Needs Fund, I'm really impressed with, because I think it's that truly does meet the requirements of our community. And so that's one thing we talked about a little. We talked about a little bit at appropriations, is making sure that the dollars that we fundraise, they go to meeting community needs. And so I think what we do with you is great. Now we have this book. We, as a token of our appreciation of coming today, this is our thank you. We, I guess it's photo op time.
Okay,
Yeah.
sounds good.
Okay,
Oh,
this
we're
way?
moving down.
Moving this way, okay.
Whoa, 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 whoa. We've got
We have a
to correct.
professional
Okay.
photographer in our midst here, and she's,
This is the best background.
Your fingers in the way.
It's a thumb.
Thank you. Wonderful.
is that okay, Don? Yeah. Well, thank you very much. So we're gonna present this book to you,
Thank you.
and thank you very much for
Thank
coming.
you so much.
And we take it back, and we, this will be in a local school, and I don't know the name of the school.
Maynard.
Maynard Public School. This is gonna be in Maynard Public School in your name. So,
Thank you so much.
and thank you very, very much for coming. We're hearing great things about you've got a great start there.
Thank you.
So, and you've had a great background in community service already. So, thank you very much.
Right.
Thank you.